So we're going to show you a video on cannulation now and how to perform it. So just a quick look at the equipment you're going to need. You're firstly going to need your sharps bin. Make sure that it's no more than 3/4 full. Next is your cannulation pack, and we'll go through what's inside that now. So you have a small bin bag to put your rubbish inside. Sharps or clinical waste don't go in there. You've then got your piece of gauze, your 2 stickers. So the green sticker is for an aseptic technique and the red sticker is for a non-aseptic technique. Then you have your absorbent sheet. This is to go under the area that you're cannulating. And then your Vecafix to secure the cannula in place. Next is your flush. Then you have your sterics to clean the area. And then of course your choice of cannulas. Don't also forget the tourniquet. Now we're going to show you how to cannulate a patient. Once you've explained the procedure to the patient and gained their consent, you must now sanitise or wash your hands, allow them to dry, and then put your gloves on. Place the tourniquet proximal to the area that you wish to cannulate. On here we're going to cannulate the hand, so therefore we've placed it proximal to the hand. Once you've located the vein, you can get the patient to assist you in bringing their veins to the surface. Next we're going to clean the area, and we can do this one of 2 ways. We can either wipe once with the ChloraPrep, or we can create a circular motion going outwards away from the vein to ensure that the whole area is cleaned and that we don't go over the same area twice. Next, now we need to select the size of the cannula. This isn't done due to the size of the vein, but more so for the reason that the cannula is required. Place your white cap on top of the cannula, inform the patient that this is going to be painful, and insert the cannula at a 10 to 30 degree angle. Look for the presence of blood in the flashback chamber. This will inform you that your cannula is now in the vein. Withdraw the needle slightly and advance the cannula into the vein. Once the cannula is in place, the tourniquet can now be removed from the patient's arm. Ensure that your white cap is kept safe and that the sharps bin is now available to place the needle inside. Fix the white cap onto the end of the cannula. Utilising the 6 R's of drug administration, administer between 2 and 5 millilitres of 0.9% sodium chloride to ensure the patency of the cannula. Also check for any bulging at the cannula site or any pain or discomfort felt by the patient. This may indicate that the cannula is not in situ and should be removed immediately. If there is no blood present, you can now remove your gloves to finish securing the cannula. Secure the cannula by putting both wings down and then add the cannula dressing on top. The wings can be fixed down prior to flush administration, but this is not necessary. After the cannula has been secured, write on your green sticker if the technique was aseptic, the time and date that the cannula was inserted. If the technique in the emergency setting wasn't aseptic, please use the red sticker, as this will indicate to the hospital that they need to remove this cannula as soon as possible. If, for one of many reasons, the cannula is required to be removed, this is the technique in how to do so. Carefully peel off the cannula dressing and ensure that the cannula remains in place. Now you need to remove the 2 stickers that are holding the wings in place. Please ensure that the cannula again does not come out at this point. Fold a piece of gauze and place this on top of the entry site where the cannula is. This will add pressure onto the site whilst the cannula is being removed. Ask your patient to hold the gauze in situ whilst you are finding some tape to secure it.